Welcome to the Deep Dive. Today we're unpacking a topic that, well, it touches on really fundamental aspects of male health, but often flies under the radar. Hypogonadism. Our mission is to really understand what it is, how it affects the body, what causes it, and, how it's diagnosed and treated. Think of this as your essential guide.
Yeah, it's a really fascinating area. It just highlights the intricate balance of our whole endocrine system. What's truly striking is how profoundly just one hormonal imbalance can affect so many different parts of your health, way beyond what you might initially think.
Right. So let's start right there with the basics. What exactly is hypogonadism?
Okay, so simply put, it means the sex glands, the testes in males aren't quite working at full capacity. This leads to lower levels of key sex hormones like testosterone. But like you said, it's not just one single thing.
It's more complex than that.
Precisely. There are different types, and it really depends on where the problem starts in the body's sort of control system. You can think of it like a little factory chain. Primary hypogonadism means the issue is right there in the factory itself, the testes. They just aren't producing enough testosterone or sperm.
Okay, so the factory floor isn't working right. What causes that?
Well, it could be things like a bad mumps infection, especially, after puberty, or certain genetic conditions, maybe like Klinefelter syndrome.
Gotcha. Any other types?
Then you've got secondary hypogonadism. Here, the problem's higher up in the brain. Specifically, the pituitary gland isn't sending the right signals down to the testes.
Ah, like the manager isn't sending the orders.
Exactly. And even higher, tertiary hypogonadism points to the hypothalamus, which is like the CEO telling the pituitary, the manager, what to do. So you see, a breakdown anywhere along that chain, CEO, manager, factory, can mess up the whole system.
Okay, that makes sense. Now, here's what probably gets really interesting for a lot of people listening. What are the actual signs? The symptoms adult males might notice.
Yeah, and they can be quite broad, sometimes subtle, really impacting quality of life. Common things are feeling really tired, unusually fatigued, low mood, or even depression can be linked. A decreased interest in sex is a big one, and maybe trouble with erections. You might also notice physical changes, maybe losing body hair, some muscle mass decrease, perhaps gaining body fat, especially around the middle, even weakened bones, leading towards osteoporosis.
Wow, okay, so it's not just about sex drive, it's energy, mood, physical changes.
Absolutely, it's systemic, and that brings up a really crucial point, something often missed. The connection to heart health.
Right, you mentioned that. How does low testosterone affect the heart? That might surprise some people.
It's a really important connection. We're seeing more and more links between low testosterone and cardiovascular risk factors. Things like increased visceral fat, that's the fat around your organs, maybe changes in cholesterol levels, increased inflammation, all things that can sort of silently impact your heart health over time.
That's definitely something to be aware of. So
yeah.
What actually causes this condition in the first place? It sounds like it could be a lot of different things.
It really can be. It's not just genetics, though that's part of it. We're talking infections like mumps, as I mentioned, physical injuries like trauma or testicular torsion where it twists. Certain medications can play a role, like some chemotherapy drugs or even long-term steroid use.
Steroids like glucocorticoids, you mean?
Yes, exactly. Also, chronic illnesses, think liver disease, kidney failure, autoimmune problems. Sometimes, honestly, the cause just remains unknown.
So how do doctors figure this out? What's the diagnostic process like?
It's quite methodical, usually. They'll typically start with a blood test to check your total testosterone levels. If that comes back low, they'll often want to recheck it, just to be sure. Sometimes they'll test what's called free testosterone, too.
Right.
If low testosterone is confirmed, the next step is usually measuring LH and FSH. Those are luteinizing hormone and follicle-stimulating hormone key signals from the brain.
And what do those tell you?
Well, if LH and FSH levels are high, it generally suggests primary hypogonadism. Your brain is shouting, basically, sending strong signals, but the test tubes aren't responding.
Got it. The signal's getting sent, but the factory isn't listening.
Precisely. But if LH and FSH are normal or even low, despite low testosterone, that points more towards a secondary or tertiary issue. The problem is likely originating higher up in the brain's signaling pathway.
And what about fertility,
Yep.
if that's a concern for someone?
Yeah, good point. Doctors might check sperm count in that case. And if primary hypogonadism is suspected, especially with certain physical signs like small tests, they might check chromosomes for something like Klinefelter syndrome. And, sometimes brain scans, like an MRI, might be done to look at the pituitary gland if a brain-related cause seems likely.
So once you have a diagnosis, what's the main treatment approach?
The cornerstone is often testosterone therapy. The goal is simply to bring those testosterone levels back up into the normal, healthy range. But it's important to monitor things carefully. Doctors watch for side effects, especially for men who might have risks related to the prostate. And depending on the cause and if fertility is a goal, the treatment might be different. Sometimes other medications are used to actually stimulate the testes directly.
Okay, that was a really comprehensive deep dive. We've unpacked what hypogonadism is, the different types, those wide-ranging symptoms, and how it's diagnosed and treated. It's really clear this isn't just about one hormone, is it? It's about a whole complex system affecting overall well-being, energy, mood, even heart health.
Absolutely. It really underscores how interconnected everything in the body is. Even, seemingly subtle hormonal changes can have really significant effects on your health and just your day-to-day quality of life.
So here's a final provocative thought for you listening. Considering how widespread and sometimes subtle these symptoms can be, fatigue, low mood, changes in body composition, what other common complaints or feelings might actually be linked to an underlying hormonal imbalance that you or someone you know might not even realize? Definitely something to think about, and maybe even something worth discussing.